Hi, this is Jason from OKC Kids Urology. Just coming to talk to you today about what happens when you first find out that you might have a child with bladder exstrophy, whether you found out in utero or you just had a baby that was just diagnosed with bladder exstrophy or cloacal exstrophy. So my wife and I found out at the time of birth. We did not find out during ultrasounds or anything like that, so it was a pretty big surprise. And I want to make this process a little bit easier for you than it was for us. So the first thing I'm going to recommend, if you just found this out, is to go to the website bladderexstrophy.com, which is the Association for Bladder Exstrophy Community. It is a nonprofit organization that is all about bladder exstrophy and cloacal exstrophy. Tons of information on that website. Most importantly, at least in the beginning, would be that the website provides what is called centers of excellence. Now, these are thoroughly vetted medical communities, whether it's a doctor's office, a hospital, or whatever it is around the world. And I believe there are 11 or 12 centers of excellence that are officially designated around the world. We at OKC Kids Urology are obviously one of those as well. And so find a center of excellence that is closest to you. I think that's usually what most people are most concerned about when they first find out about this, is they want to find a doctor that is relatively close, that doesn't require a plane ride or something of that nature. Now, it is very possible and very likely you will require a plane ride if you're not in a common metropolitan area. So don't be afraid of that. That is a minor concern. These days especially, we have Zoom and other virtual methods of meeting with each other, and it's a wonderful tool, at least in the beginning, to gather information. So that would be the first thing I would say. Get connected through bladderexstrophy.com. And secondly, I would say download our Bladder Exstrophy app, if I can plug that, just because it has a wealth of information that hasn't existed. We just came out last year, and it's a wonderful tool that we're always updating and adding information to. So if you have an iPhone or Android, it doesn't matter. It's on both stores. Go to your store and just search the words Bladder Exstrophy and download our app and get more information that way. So again, I think in picking a doctor, in terms of picking a pediatric urologist, you are going to want to find someone who does have that expertise from a center of excellence. And that is highly important, not only because that person is trained in bladder exstrophy, but they're regularly doing those types of surgeries. They're well aware of all of the different types of complications that can come along with that. A standard pediatric urologist that does not have that training, I would not recommend, just because they don't have that experience and expertise. So I would start there. Secondly, we want to know from that urologist, what does their urology team look like? Some have a private practice where they are connected to a local hospital. I would want to know, are the nurses and staff at the hospital also trained in exstrophy so they know how to do aftercare? Your pediatric urologist is obviously going to be the one doing any sort of surgery or procedure, yet at the same time you want to be able to have detailed and thorough follow-up so that the nurses are all on the same team and everyone's working together, so that, because there can be a lot of misinformation from one expert to the other. So I'd say that's another important thing. Thirdly would be being able to make sure that you are connected via cell phone and other common ways. These days, I don't have a cell phone number for my general practitioner or family doctor, but most pediatric urologists, because of exstrophy, if they are a center of excellence, will give that to you, and you can text them, call them, or email them with minor or major concerns or questions, and you'll get a fairly quick response, usually same day, because we all know how concerning exstrophy can be and how symptoms can be and how there can be emergency type issues. So I'll say, if you find a urologist who is readily available, who is quick to respond, who will give you all their time and energy as needed, I think that's a valuable thing. Bedside manner, we all know, is incredibly important, because you're worried for your kiddo. You want to make sure that they're getting the best care, they're not getting sick, things like that. To piggyback on that as well, I have met some parents over the years that frankly are petrified of going against some of the doctor's orders. Now I believe that my son's doctor and most pediatric urologists are very good and they're very wonderful people. However, they do want to do things that they believe is in your child's best interest, but I also want to give you as parents confidence to know You know your child better than anybody else. You probably know your child better than they know themselves. And I want you to keep that in mind, because as a parent, you are the expert. And again, I know that might sound a little bit contradictory. The reality is your exstrophy doctor, your urologist is great, and they know lots and lots of things. But every child is different. Just like your oldest child is going to be different from your middle child, who's going to be different from your youngest child. But you know why they're different, and you know how to address those issues as they come up and show those differences. If you tell a doctor about those things, they're going to know a little bit about that, but they're not going to know what that looks like in reality. So keep in mind, if your doctor wants to do something that you don't really care for or don't agree with, or you've witnessed in the past has not had a good outcome, please say that. I want you to have the confidence to be able to say that, because I think that you're fighting for your kiddo's best health, best long-term care, and all those kinds of things. So here's a perfect example. When my son had his most recent surgery about 1.5 years ago, we have some serious concerns with my son because he does not react the best to narcotics. And if you've seen my previous videos, I also mentioned how we did the last surgery without any narcotics and simply using ibuprofen and similar things. So because of that, Dr. Kropp, who did his last surgery, listened to us and heard our concerns and our issues. He gave us his professional experience of, like, here's how this could work and here's how it might not work. Wanted us to be aware of the pros and cons and potential outcomes. And then we made a decision together as a team. My wife, me, and him all made this decision together to say, hey, let's try it the non-narcotic route. If his pain is too much and he needs a little bit, of course we'll give that to him. But we were able to do the whole thing without it, which was wonderful and a godsend, frankly. So again, I want you guys to know that you are the expert in your child's lives. Your doctor is an expert in exstrophy, but not necessarily your kid. If there's one thing I've learned about bladder exstrophy, every case is different. Nothing is the exact same. It's not like a broken arm. You can probably fix every broken arm almost the exact same way with some minor variations. But with exstrophy, it's up and down and left and right and all over the place. So keep that in mind. There's just a lot of variation, a lot of differences that can happen. But again, most importantly, have confidence in yourself as a parent. If you have a spouse, hopefully you guys can consult together and work together on what do we think this kid needs, as well as being able to present that to your urologist, who hopefully will hear you out and really try to understand your points of view and your perspective.